Well, welcome, Dr. Rachel Zummel, who is a small animal general practice veterinarian here in South Lake Tahoe, California. She does happen to be Pancake's veterinarian for those of you who follow our social media. And since this is Pet Dental Health Month, she'll be telling us a little bit about her experience and recommendations from the general practice point of view when it comes to your dog's teeth. Okay, so first question is, how often when a dog comes in for some other purpose, maybe vaccines, wellness check, or some health issue, how often do you see dental disease in those dogs coming in for something else?
All the time. It's actually pretty rare for me to see a dog that doesn't have any level of dental disease. Most dogs have at least some gingivitis that's apparent on a regular exam. And then, it gets worse from there. So tartar, recession, mobile teeth. But it's really rare for me to see a dog that actually has fully healthy mouth.
Okay, so most dogs coming in have something going on in their mouth. It's not great.
Yeah.
Um, how soon do people have to start thinking about this? A lot of folks who have younger dogs, are thinking maybe they don't have to worry about it yet until the dog's a bit older. What age are you seeing dental problems starting?
About one. So
So
it's
really
really,
young.
yeah, it's really young. So the dogs that I see that really have purely like totally healthy mouths are going to be really young dogs, like less than a year of age.
Okay.
Once they get past that point, almost all the time, there's going to be some gingivitis somewhere. That said, that's usually at the reversible stage where if we start brushing those teeth, that will go away and there might not be so much tartar buildup that we can get away with just brushing. But yeah, young is the time to start because that's when you can still address it in a preventative way instead of trying to play catch up later.
Okay, so say someone's dog is apparently healthy, eating fine, um, maybe relatively young. How bad can their teeth really be? Like if their dog seems to be okay, seems to be healthy.
Yeah. Well, I would say that it is extremely rare for me to have a dog not eat because of their teeth. That almost never happens. And if it does, it's because of an acute worsening with like an abscess or something like that. I mean, you experienced it with Pancake recently, right? We thought his teeth looked pretty good from the outside. And then I don't remember how many teeth did I take out? 7. So yeah, so it can be pretty bad. I've definitely had dogs that I thought I have dogs all the time where I think, oh, I'm going to go in, we're going to do a cleaning and we're not expecting to find much. And then we end up, as we did with Pancake, finding a whole lot of things that are probably causing pain. Yeah.
So that kind of covers the next question, which is how can I tell if my dog has dental disease? So it sounds like behaviorally,
Yeah. It's
probably
really
not
tough.
pick up anything. What
Yeah.
else can people look for?
The obvious signs are going to be red gums, inflamed gums, that tartar on the teeth that everybody knows doesn't look good. It's really not the tartar on the tooth that counts and is bad, though. It's the tartar under the gum line. But if there's tartar on the tooth, there's tartar under the gum line. Like
Yeah.
you can reliably state that. And bad breath. I think that's probably the easiest one. We're all kind of used to our dogs having bad breath, but that is not actually a healthy state of being. So if the breath is bad, there's dental disease, or rarely something else, and they should be evaluated.
What if I can't touch my dog's mouth and my dog is terrified of the vet? So they're really
Yeah,
reluctant to put their dog through this traumatic experience.
right. Yeah, it is so hard. I guess, as we have done with Pancake, I would, find a vet that is willing to work with you extensively to make it as least traumatic as possible. Pancake has a whole regime of the meds he gets beforehand, and then the way we do the handoff and the way he gets his meds initially to sedate him so we can do his preoperative work and everything. So he has a whole routine that my whole staff knows Pancake's around because we change the way we do a lot of things for him. So finding a vet that's willing to help you through that, I think, is going to be key. And you're going to need that for other areas of your dog's medical care anyway. So I think putting the effort into finding that vet is well worth it. I know there's going to be situations where you're not in an area where there is a vet that's, a good fit, but I would definitely do your best to make that work.
As a follow-up question, some people will probably be asking, how do I find such a vet, or how do I establish that kind of relationship with a new vet? Like, can I call
Yeah.
them? Do I make an appointment with just me and not my dog and talk to them?
Yeah, it's super hard because vets are super busy, and a lot of vets are not super interested in behavior and may not really want to invest that time. They've got a lot of other things on their plate. So I think, it's always reasonable to start with the fear-free directory. Those vets at least have shown some interest in making vet visits less anxiety producing for your pets. I will say, like, I'm not even on that directory anymore, so it's not all inclusive, but it's a good starting point.
Yeah.
Certainly talking to other people in your area, certainly if they're on your Facebook group or something and they can get a recommendation, then that's a good place to start. I would not expect to be able to call a veterinarian and that you haven't ever seen before and have them call you back. That's just not, they don't have time for that. So I would make an appointment. And then if you really cannot bring your dog to that appointment without, drugs on board, that kind of thing, then I would, tell the receptionist when you schedule it, hey, my dog has extreme fear and anxiety, and I don't think I can get him in the door. Is there anything we can do? And they will send that to the veterinarian. And that can be a good litmus test too, of like, if that vet is just like, well, you're just going to have to carry him in, then maybe that's not the right vet. If that vet offers some additional options, like, well, could we come out and just visually see him in the parking lot so we can establish a legal client-patient relationship, and then maybe we can prescribe him some anxiety meds and you can come back for the exam. Or we can, in some cases, those meds that we give ahead of time, like oral meds, are just not going to be enough, right? That's the case with Pancake. Then they can make a plan for sedating with injectable medications and how they're going to manage that. If you go into it of like, I really want to help my dog, we're really stuck because he's, extremely fearful and like, help me problem solve. Then they're going to be, you'll get an idea of what they can and cannot do for you.
Okay, so next question is about coconut oil. Can coconut oil be used for dog dental health? And I don't know if they're talking about in brushing or just as a supplement or what.
Testing it. Yeah, I don't know. I've never seen any studies or recommendations from the specialists regarding coconut oil, so I would not recommend it myself. I don't think it's going to hurt either thing, but I don't, I wouldn't expect it to make a big difference either with brushing or with, it's the brushing that makes the difference. It's not even really the toothpaste that makes the difference. So it almost doesn't matter what you put on the brush.
Okay, raw meaty bones are very popular with folks, and there's certainly perception that they are a benefit to dental health in dogs. Do you have any info on that?
Yeah, so there's no doubt that chewing is good for dogs, right? Behaviorally, it's great for them. There is definitely some benefit of the chewing action. I mean, that's why we use dental chews. That's why we use the TB food. Those kinds of things work the same way. The problem with the raw meaty bones, raw food, having raw meat in your house and the challenges with keeping that safe aside, is that they can break their teeth on those. And I see that all the time. Broken teeth from bones, be they raw or cooked or whatever, is extremely common. And I know folks a lot of times will say, oh, but wolves chew on bones and that's how they keep their teeth healthy. And actually the study is looking at wolves. They have terrible teeth and it shortens their life, right? So their lifespans are not nearly what our pet dogs are. And they, the older wolves always have, fractured, infected teeth in there. And there's no chance that's not affecting them. I think the other challenge with bones and any kind of chewing item to manage dental disease is that it's really only going to work on the chewing teeth, right? when they chew on a dental chew, they're chewing with those back teeth. They're not going to chew with their incisors and their canines. And so sometimes those dogs that we're really relying on those chewing things on, I'll see the back teeth look fairly good. And then the front teeth are a disaster, right?
Okay.
Or just have worse gingivitis, recession, all those things. So even if you're feeding anything for chewing, you still need to brush those teeth so you can get to those other teeth.
Okay, well, that was the next question was, if I am giving my dog raw bones or dental chews, how often do you recommend toothbrushing with pet toothpaste?
Every day. Sorry.
I know everyone's wishing that, there's something you can
Yeah,
do with your dog and
me
it would
too.
fix
I would love to
everything.
not have to brush my dog's teeth every day.
Yes.
But yeah, unfortunately, there's nothing that replaces toothbrushing.
All right, so our message this month is learn to brush your dog's teeth if at all possible. And if not, there are other things you can do, like those at-home products and also veterinary dental cleanings to help your dog. All month, our toothbrushing course is 50% off, and the link is at the bottom there,